President of the Galen Institute, Grace Marie Turner. Welcome.
Thank you, Liz.
Thanks for being here. So talk about this loophole here. I mean, I thought Obamacare was specifically designed to help people in need, but this is saying the complete opposite.
Well, and it's because, as you said, the Supreme Court rewrote the law. When the law was written, it basically said that all states were going to have to cover everybody up to, say, a family of 30 making $30,000 under Medicaid. Well, the Supreme Court said, no, that's optional. And so the states are able now to decide whether or not to expand it. I think Medicaid is a terrible program. It absolutely needs to be reformed. People do worse on Medicaid than they do being uninsured. So we've got to reform it, and that's what the states are saying, we're resisting this. There have to be better solutions for people who need coverage, but not putting them on a failing program.
So you're saying that it's obviously in the state's best interest to opt out at this point, and possibly the Americans out there in those states, so you can't blame them for opting out of this system and trying to create their own, correct?
That's right. But a lot of states are coming forward with creative plans. The Speaker of the House in Florida, Will Weatherford, for example, came up with a plan where he said, we need to see who really needs help with health insurance, and we're going to create a state plan with these same dollars. Even though this plan is supposed to be mostly paid for by the federal government, this expansion population, states still would have to pay $118 billion over this decade, and they're saying we can spend that money better covering people our way rather than all of the red tape and all of the bureaucracy that comes with Medicaid.
You're saying a tailored program for each state may be a better option than Obamacare.
Well, yeah, the expansion of Medicaid under Obamacare. And they're looking particularly at the population making 70% to 100% of poverty that fall through the cracks, because Obamacare picks up people up to 100% over 100% of poverty. But it's under that we really need to take care of this population. And I think that's something the states can do a better job than the federal government with.
Sure. And the